Good
Hi, Zahra.
afternoon, everyone. Hi, Rupa. Hi, everyone that's joined us. And welcome to our All Things Menopause webinar today. For anyone that's not familiar with the webinars or hasn't previously joined a Boots Online Doctor webinar, I just want to tell you a little bit about some of the functions that we have available. So there is a chat box where you are welcome to kind of interact with each other and share your thoughts and feelings on anything that we've said. We've also got a Q&A box where you can send us questions. They are confidential, so no one else would be able to see what you're sending to us. And I'd just like to take this opportunity to introduce myself. So my name is Dr. Zahra Damji. I am a GP and the Women's Health Lead for Boots Online Doctor. I've been working on our menopause service for about 2 years now, and I have to say it's something that I really enjoy doing. It's a very interesting and valuable service, I think, that we offer. Over to you, Rupa.
Thank you, Zahra. So my name is Rupa Lyall. I am a pharmacist, independent prescriber that works for Boots Online Doctor. I have the privilege of working with Zahra on the menopause service. And I love it. And I think it's a great opportunity for pharmacists to get involved with the menopause itself. And yeah, and it's a great opportunity to be here today with all of you.
And for anyone that's not aware, this October it's Menopause Awareness Month and International Menopause Day next Friday. So we just wanted to take this opportunity to kind of really reignite the kind of conversation around menopause. We know that it's something that people are talking a lot more about these days, but I hope this is an opportunity for us just to give you an overview of what is quite a wide area and wide topic to talk about, but something that is really important to us. There is a follow-up webinar in this series that will be around menopause and the skin, which will be hosted by Rupa. And for anyone that hasn't seen, we also run a series of webinars around weight loss, and there are specific webinars in that series that relate to the menopause. And again, with Rupa featuring quite strongly there. So yeah, please do feel free to ask questions along the way. We'll try and answer as many as we can, or just post your comments. It's really great to hear from you.
Yeah.
I think it's really important for us to recognise that, this is a topic that is complicated and complex, and really important that we recognise that it's not a sort of one size fits all approach to menopause. There will be people that go through a very traditional journey, but there'll also be people whose experiences are quite different for multiple reasons. Rupa, we were at an event last Tuesday run by Boots and Macmillan, which was around women going through early menopause due to cancer. And it was a really interesting experience for us. I think we both learned a lot. And one of the things that I really took away from that was around kind of how people approach the discussion of the menopause, particularly in younger women. And the group of women that we listened to were amazing at speaking, but there was a common theme there that when they were talking about their treatment, people didn't actually talk about the menopause. They didn't really mention that as a word. What they were saying was, oh, fertility may be an issue, your ovaries may be paused, but they didn't say you're going to be going through the menopause, and actually recognizing that there would be fairly significant changes happening. So hopefully today, although a lot of what we talk about is that kind of more traditional, ages and so on, we just wanted to make sure that we recognise that it's not the same for everybody.
Correct. Definitely.
So this is just an overview of what we were hoping to cover today. So it's very general, and we'd like to talk to you about what the menopause is. What does it really mean? What are the different stages? People bandy around terms, which sometimes for us as healthcare professionals are things that we use very easily, but we want to make sure that they're things that are then clearer for you if you're perhaps having that conversation with someone. So if they are using a little bit of medical jargon, maybe it makes a little bit more sense. Talking about some of the signs and symptoms, there are ones that are very commonly talked about, but actually also recognizing there are things that potentially could be due to going through the menopause that maybe are less commonly spoken about. And then we've kind of termed it treatment options, but essentially we mean what are the options in terms of helping to manage your symptoms. So I think what we're going to do first of all is to do a poll with you all. So we would just love to have a little bit of a better idea about who our audience are today. So our first poll is, I'm sorry, I clicked the wrong one. Let me go back a second. Right. Our first poll, let's go again. Is here, right? Okay, it's just to get a bit of an understanding about what your understanding is around the menopause. So these answers are all confidential, just for our interest, and then we'll share them with you. Okay.
It'd be interesting to know.
Yeah, because I think we talk a lot about it, Rupa,
We
don't we, in our day-to-day lives, but we also have to recognize that for some people, this might be something that they've never really had that conversation about. And I know we also talked about how maybe 10, 15, 20 years ago, people perhaps didn't really talk about the menopause. It was something that just happened. But actually, we're really glad that the conversation is happening. So I'm just going to show people some of the results now. So essentially, it sounds like people have a varying degrees of knowledge there. So someone who's maybe not got so much knowledge, some people who have basic knowledge, which actually I think is really what we're hoping to enhance on, and then a few people that have a lot more knowledge. So we'd really welcome those people that feel like they do have a little bit more knowledge to really add any comments or opinions along the way. Love to hear from you all.
brilliant.
Okay.
It's really, really helpful to know because hopefully we'll be covering a lot of this and the fact that people know basic information but not clear on the details, hopefully we'll be able to clarify that a bit more, and especially the difference between the perimenopause and menopause, which is quite important to know as well. So brilliant. Thank you for participating in that.
So you just mentioned that, Rupa. So I think a great starting point is let's actually explain what is
Yeah.
menopause to everyone.
Absolutely. So the menopause is a word that we hear now all the time on TV, amongst friends, when we're out for dinner, whatever it is, we're hearing it all the time. So the menopause, by definition, is when a woman stops having her periods for 12 months or more. And as the name implies, meno means monthly, and pause obviously means to stop or cease. Now, what happens is that the ovaries stop producing estrogen, and then causes that stopping in your menstrual cycle, along with a lot of other symptoms that we're going to go into detail about throughout this webinar. The average age in the UK to reach the menopause is 51, but that's not set in stone. It can be very much before that, and it can be after that as well. But it's also possible to be still having your periods, but having menopausal symptoms on top of that. And that's called the perimenopause, and we'll go into detail about what that looks like shortly. But that's kind of the sums up what menopause is. Would you agree, Zahra? Anything you want to add on to that?
No, I think that hopefully will help people just understand is that moment in time. Maybe before that you are potentially perimenopausal, after that you are postmenopausal. But you can have symptoms and management of menopausal symptoms before you actually reach that point of the menopause.
Absolutely. So this graph is one of my favorite graphs. So hopefully this will, just bear with me. My screen is doing something. Just trying to get rid of something at the moment. That's fine. So this graph and these pictures will hopefully explain a bit more about the transition into the menopause. So when we're in our 20s and our 30s, we're at the pre-menopause stage where we're quite, vibrant. We think we know a lot about life. We don't. We're learning, we're growing up. Our hormones, the most important thing, are quite consistent and balanced. So we don't have menopausal symptoms at this stage because everything is quite even and balanced, like I said. Then as we enter our 40s, you can see a fluctuation in the hormones. They're up and down, they're all over the place. And this is what causes changes in your cycle. Some women have very normal periods, but mostly women, because of that up and down and the inconsistency of these hormones, start having changes in their periods. So they can be more irregular, they can be more sporadic. So you can have gaps between your periods. They can be heavier or lighter. Bleeding patterns change. But what also happens is whether you're having normal periods or irregular periods, you're having menopausal symptoms on top of that. So this can be very confusing for women. They think, well, I'm still having my periods. Surely I can't be going through the change, but that's not entirely correct. So I would always advise women at this stage, at the perimenopausal stage, that if you are experiencing these kind of symptoms, there's fabulous questionnaires that are available online if you Google them. And if you are experiencing any of these symptoms, it's always a good idea to use these questionnaires as a tool and discuss it with your doctor or clinician, whoever specializes in your surgery for menopausal symptoms. Now, what happens is if you are 45 years and over, you don't need a blood test because it's assumed you're going through the perimenopause anyway. But if you're getting these symptoms under the age of 45, it's important that you have blood tests done. But blood tests don't always indicate that you are, the diagnosis of menopause is correct because it's all based on symptoms. Then what happens is you can see a complete drop in those hormones as you enter the menopause stage. And this happens, like I said, around age 51. And this complete drop is when the ovaries just stop producing any hormones. And then you reach the postmenopausal stage, which is literally just after 12 months and 1 day into it, you're into the postmenopausal stage for pretty much all your life. So that kind of sums up what that transition looks like.
Great, thank you, Rupa. And I think it'd be really interesting if people don't mind participating to find out, where do you think that you sit in this kind of journey at the moment? So we've just got another poll, if that's okay with everybody. Sorry, that's going to be appearing on your screen. Rupa, we've had a question whilst people are looking at that poll. So someone's written, how can I tell the difference between perimenopause and stress and burnout?
Well, stress and burnout is it's you've got to find out what's causing the stress and the burnout. Is it actually, are you having changes with your periods? Are you having these symptoms that we're going to talk about a bit more? But I think identify what your stress and burnout is. Is that because of your lifestyle? And then work on it from there. But I think we'll go into a bit more detail about this kind of the stress component, especially, and how we can help.
Yeah, no, absolutely. And I think that's really important that it's also a really difficult question to answer because there is so much overlap, and we will talk a little bit more about, particularly at certain times of periods life where there's lots of life changes going on, that actually there can be a real blurring between what's going on, and that can sometimes mean that it's difficult for people to get help because either they're not quite sure or even their doctor's not sure. So yeah, something to really recognize and look into a little bit more.
I think that's why those questionnaires that I mentioned are really important, because they actually do help recognize and monitor your symptoms. So when you do speak to your clinician, you can say, look, I've been monitoring my symptoms. This is what I have. Can you help me? So I think going in with something like that powerful tool is really important.
Yeah, what we can do, hopefully, Rupa, in a few minutes, is actually just share some of those questionnaires in the chat. So we'll pop one of those in there in a minute. Thank you to everyone who's participated in that poll. So we've got a little bit of a mix, and actually that's really great. So people coming at this from all different angles, people who haven't quite got to the point of going through the perimenopause yet, people that are in those earlier stages, people that are currently right there of like things changing, and even some people who have kind of come out the other end. But see, as we'll talk about, that doesn't mean that you're not necessarily getting any fewer symptoms, and it may even be worse than it was when you were menopausal. Okay, so I think it'd be great to just talk about some of the signs and symptoms as we've mentioned. Now, I think if we ask the question, like, what are the common symptoms around the menopause, then there'll be some that people mentioned more frequently than others, but actually there are probably at least 40 symptoms that are recognised to be related to menopausal changes. We talked about period changes, and so sometimes period changes can be the first kind of indication that something's going wrong. I think people think that sometimes people think that periods are going to maybe just stop or just become less frequent, but actually there can be other changes that can be considered to be typical of the perimenopause. So sometimes less frequent periods or heavier periods or lighter periods. So it can be quite confusing and difficult to know exactly what's going on. The most kind of common symptoms that we do hear people talking about are hot flashes, night sweats, vaginal dryness, loss of libido. There's lots of things to be thinking about. So we're just going to cover in a little bit more detail about some of the more common ones, and hopefully try and explain a bit about what's going on and the science behind them to help explain why people are experiencing these so commonly. So hot flushes, let's start by talking about that, and that kind of coincides with night sweats. It's not actually really clearly understood exactly what's going on, but the science behind it kind of we think is related to changes in the part of the brain that regulates temperature, which is called the hypothalamus. And as Rupa mentioned earlier, there's a drop in estrogen as we're going through the menopause. And so you'll hear us kind of referring to this quite commonly, unfortunately, but it's that drop in estrogen that leads to these changes. And what happens is the hypothalamus becomes more sensitive, so even to very slight changes in body temperature. And when the body's becoming very warm, it does two things primarily to try and cool itself down. Increased sweating, so that's obviously producing water that then tries to cool the body down by when it's kind of getting rid of the heat. And then flushing, which is where the blood flows to the skin, again, to try and cool us down. And this is associated with some changes in the brain chemistry around kind of some of the chemicals that you may have heard of around called serotonin and noradrenaline. Rupert, I think at this point it might be helpful just to give people some tips about what they might be able to do to help manage hot flushes and night sweats.
Yeah, absolutely. I think there's one example that I want to share actually, where a lady actually on our service told me during the summertime that her hot sweats and her hot flushes and night sweats were so bad, because they can be very debilitating, can't they? That she actually had to cancel her holiday to Spain because she couldn't handle being in a hot environment. That's quite sad to know. And she shouldn't have to, but she just couldn't control those symptoms. But there's lots of things that people can do to help. The obvious ones are using fans and wearing light clothing, making sure you're not overheated in your bed at night as well. You can even leave the window open to allow the fresh air to come in if it's not too cold. But it's also advisable to avoid certain triggers like caffeine, eating spicy food, alcohol or stress, particularly before bedtime. I'm sure people do this anyway, but it's kind of a reminder with the basic information. You can also get lots of cooling mists and sprays from pharmacies nowadays, and cooling bracelets, I believe, as well, that you can get. But work with what's best for you. There's a lot of information out there that you can read up on. But I would always advise visiting a pharmacist or their pharmacy team as well in store to get more information.
We've had a couple of questions around hot flushes. So one of the questions was, can perimenopause hot flushes happen more after eating, or is this likely something else? So I think, Rupa, you've alluded to some of the typical foods that can cause hot flushes to worsen. In terms of the answer to that question, is it something else? Obviously, you need to take into account if there's any other symptoms related to that. But if that's primarily the symptom that you're experiencing, and maybe you are of a typical perimenopausal age, then hopefully that kind of helps, and that it's often related to certain types of food. But if you're not sure, it might be worth just keeping a food diary. So actually kind of seeing it, are there things that you're eating that actually you then see that there is a pattern between them. We've also had a question that says, I've been getting lots of hot flushes in the last year or so, but mainly when I'm on my period. Is that just period related, or could it be perimenopausal symptom? It certainly could be a perimenopausal symptom. Hot flushes typically aren't a common symptom just of a period. Some people do experience them because obviously there are hormonal changes going on through your period. But if this is something you're consistently experiencing, then I would certainly consider that you could well be on that perimenopausal journey at this point. We've just got another question as well, which I think we can maybe answer now before we move
Yeah.
forward, which is, when you are postmenopausal, is it normal to still experience the odd ache in the ovaries similar to period pain? I probably would say that's a difficult one for us to give you a black and white answer about. If it's something that you are experiencing commonly and it's persisting, then I probably would get that looked into. If it's something that's happening kind of on a monthly basis and you've just stopped your periods, or they're just starting to kind of stop, then that could be normal. But if it's something that you've maybe had a fairly long gap since your period, and then you are having this pain and it's persisting, then I would advise you to speak with your GP about that.
Yeah.
Okay. Great. So we actually are going to do another poll at this point. So let's see. And this is just to kind of find out whether people are experiencing any of these symptoms and what the most common ones you are experiencing. if you are at all, because obviously we recognise there are some people here that may not be getting any symptoms at all.
Great to know people are participating in this.
Yeah, thank you. I think that's really helpful for us again to understand sort of where we should be, what we should be talking about. So I think we'll give it another few minutes. So Rupa, you've been doing lots of webinars around weight loss as well, haven't you?
And that is a very, very obviously weight changes is the number one one of
Yeah,
the number
it
one,
is.
unfortunately.
I'm actually going to end this poll and share the results with you just so that people can see that that's interesting. That actually weight gain is reportedly on our poll anyway, the most common symptom that people experience. And that's something we certainly will be touching on a bit more. We've also had a comment in the chat about brain fog and memory problems.
Oh,
So
yeah.
something that actually we probably should have had on here, and hot flushes and insomnia really high, and loss of libido. So that's definitely something we'll be talking a bit more about. So thank you, everyone. It's really helpful to understand kind of what people are experiencing at the moment. Okay. So hot flushes, we've talked about low libido, as we mentioned, that's something obviously that is affecting people. And so we're going to kind of come at it from a couple of different angles and start off just by talking about vaginal dryness. Now, it was interesting, Rupa, when we went to the event that I mentioned earlier about women who were experiencing early menopause due to cancer. One of the things they said that actually vaginal dryness was something they felt was quite an awkward subject to bring up or to talk about and get help about. But it's really, really common. So hopefully we can give you a little bit of guidance here and advice. Feel free to ask questions. And then maybe if it's something that is bothering you, this will just give you a little bit of a encouragement to go and ask for some more advice. So vaginal dryness, typically people report symptoms of itching, burning, dryness, and can cause people to experience painful sex. There's often a lot of overlap in the symptoms with a urine infection. So somebody might think that they're maybe experiencing urine infection when actually it's because they have what we often describe as vaginal atrophy, so very thinning of the skin around the vagina. Why does it happen? Well, as we mentioned earlier, a lot of these things are due to a drop in estrogen. And so that's typically the reason that women experience this. And it can often go on from the very early kind of perimenopausal days, often to quite a later stage of the kind of postmenopausal days. It's often one of the more common things that perhaps like the older women are still reporting as a symptom and an issue. There are estrogen receptors typically in that kind of vaginal skin area. And so when the estrogen levels drop, what we see is a reduction in the amount of collagen, which is kind of what's holding the skin together. And so it becomes drier and less elastic. And that coincides with a natural drop in the lubrication and a change in the vaginal pH. So you've got all these factors coming in together that lead to, unfortunately, a very common symptom of vaginal dryness. And so when we put that into context around low libido, which is something that we have obviously seen is a very common symptom affecting people on this webinar, as well as obviously women that we see very regularly, there are again multiple factors that can play a role, and vaginal dryness being one of those. But then we also see that the changes in the hormones can lead to arousal difficulties and difficulty achieving orgasm, and all those factors then lead to a reduced interest or a lack of interest in sex. This coincides as well with a reduction in testosterone. So for anyone that's kind of had testosterone banded around, often we often refer to it as a male hormone, but actually it's something that's really important to women as well. And we do see a natural decline from sort of the age of the sort of mid to late 30s in testosterone levels. And so those multiple things going on can lead to reduced interest in sex and therefore a low libido. So thank you, Rupa, for kind of moving the slide forward. So what can we do to help? And that's obviously the most important thing at this point. I'm sure probably rather than hearing about why it's happening is actually what can we do to help manage it? There are multiple different aspects again, and it might be that it's not just one thing that needs to be done. Actually, we need to be thinking quite broadly about the different options available. So, as we mentioned on the side, lubrication. So lubrication is something that you can generally buy over the counter. There are lots of different types of vaginal moisturising lubricants, and they're important to be using on a regular basis. So you can have vaginal moisturisers, you can have lubrication that you use specifically when you're having sex. Then the other kind of things that can help. So you can get different types of vibrators, smaller ones if that's helpful, dilation sets if it's particularly difficult, so that you can build up perhaps confidence at home, even on your own, to make you feel more comfortable. And masturbation as well, which can just help relax the body a little bit more. Pelvic floor exercises, I'm sure for anyone that's given birth, that's something that was drilled into you, but maybe not everyone's very good at doing them. And actually, even now, getting into pelvic floor exercises can just increase that tone around the body, and then just make sex more enjoyable. And then there are medication options. So one of the things that we do day to day is looking at hormone replacement therapy, and there are two types of hormone replacement therapy that could potentially be useful in this situation for somebody who's maybe on HRT already. It could be adjusting the doses to perhaps maybe slightly increase the estrogen levels that you're getting, and they're also, where appropriate, for some women there is a local estrogen that typically comes like in a pessary, so like a little tablet that you can insert into the vagina. They often need to be used very regularly for the first couple of weeks, just to build up and thicken up the vaginal skin, but then after a while can move on to kind of more maintenance regime, so using sort of every maybe twice a week, just to kind of carry that on. But there are options available, so that's worth speaking to your GP about if you think that that might be beneficial to you. And then obviously, depending on people's circumstances and situations, it may be that sexual counselling is relevant to you and worth considering.
That's really, I was just going to add in, Zara, it's really helpful what you said, but if a woman is on HRT, she can have additional vaginal HRT on top. So I think that's, we do get some women asking if they can do both, and you can, depending on how well the HRT in general is working for you. If it's not improving your vaginal dryness, you can have the vaginal estrogen on top.
And just on that, I think that's a really good point, Rupa. And some people here may have been told that they're not allowed to have HRT, so systemic HRT that you take, in tablets or patches and things. Obviously, very important to be checking with your doctor, but there is an option sometimes for those people that they can actually use the local estrogen. So worth a discussion if you feel that's relevant to you.
Completely.
So the next one we're going to be talking about. So we put on the aches and weight gain, but I think primarily if we start talking about muscle aches and joints, I think that would be a good starting point in terms of what we discuss next.
Let me just, yeah.
I think this is sometimes a little bit of a tricky one, because again, it might be that somebody thinks that they've got like aches and pains because maybe they're getting a bit older, or weight distribution changes, but sometimes it can be more directly related to going through the menopause. And I feel like a bit of a broken record at this point. Why does it happen? Well, it again comes down to that reduction in the estrogen levels that we see as people are kind of transitioning through. So estrogen has a really important role in our bodies for protecting joints, reducing inflammation. And so when the levels drop off, sometimes people present with pains in the joints. Pains in the joints in itself obviously can be a frustrating symptom, but it's also the consequences of that. So actually my joints are painful today, therefore I don't want to exercise, and therefore I'm not exercising, I'm more sedentary, and subsequently I'm losing muscle and I'm gaining weight. So there are multiple reasons why this is such an important thing to be talking about. So I think the other thing that we were going to talk about, Rupa, is that it's not just estrogen changes as well, it's about testosterone. So we mentioned testosterone with regards to low libido, but sometimes a drop in testosterone can also lead to a reduction in the strength of our muscles. And the other thing we also need to talk about is around osteoporosis. So for anyone that's not heard of osteoporosis or isn't familiar with the condition, um, simply put, it's a kind of thinning of the bones, and osteoporosis comes on a spectrum of kind of normal bones to osteoporosis. And you also may have heard or may hear a condition called osteopenia, where the bones are slightly thinner but maybe haven't quite got as bad as osteoporosis. And this is common around the menopause as well. It's something to be discussing with your GP, because there are ways to help manage it. From a practical perspective, weight bearing exercises, so primarily walking, is a really great way to kind of reduce the risk or help manage someone who's already been diagnosed with thinning of the bones. And osteoarthritis, which is also something that typically comes with age as well, a wear and tear of the joints, classically the knees, the hips, that's also more common and more prevalent. So it's really important that if you do think that you're experiencing these symptoms, that it is worth seeing the GP and discussing kind of what's going on. And they may talk to you about, we mentioned weight bearing exercises, other medication, and also vitamin supplements. So primarily looking at vitamin D and calcium. So we've also got weight gain as well, Rupa. I know this is something that you've been talking a lot about in your webinars recently, as we've mentioned. I know you've kind of clicked onto sleep there, but we'll just come back to weight gain a little bit first of all. In terms of weight being an issue, we've obviously seen that it's the most common symptom that people have recognised today, and there are multiple reasons why this happens. If we try and simplify it again, I feel like I am saying the same thing, but
Yeah, it's pretty repetitive, isn't it?
yeah, well,
It
it's
is.
that estrogen level again. So I suppose it helps us understand that these changes are happening because of those changes in our body. So that they are the consequences of going through the menopause, that and maybe help people understand why they're happening. But the drop in estrogen can actually then affect the distribution of fat. And so it typically gathers around the middle. So I think people, when they think about the kind of weight changes, it may be that there is an obvious kind of actual weight gain, but also an obvious change in appearance because of that distribution. So for anybody, we know that with age, muscle mass will decrease and fat will increase. And this is because there is a natural slowing down of the metabolism, and that is the rate at which the body burns calories. So if your metabolism is slowed down, you are actually going to gain weight if you were to eat exactly the same thing. So if you ate the same thing the whole of your life, actually, as you get older, you would start to gain weight because you're actually just not burning it as quickly as you would.
Mm. I think those changes can be pretty scary, can't they, Zara? Because suddenly, and they can be quite rapid, the way it just happens in the middle. Suddenly
Yeah,
finding that you're not fitting into your clothing anymore. And it has an impact on your self-confidence, your self-esteem. That in itself makes you feel low.
yeah.
So it sounds all doom and gloom, but there is hope.
Well, I know we kind of clicked onto the next symptom being sleep, but actually, there's so many things that you have to think about when you think about what's contributing to weight gain. So, obviously, we mentioned about the kind of what's happening with your body, but it's the consequences of that as well. So, we've spoken about the fact that actually it's going to affect your joints. So, you don't want to exercise because it's painful to exercise. We're going to talk about sleep. So, sleep is a factor. We had a question earlier about stress. Stress is a common symptom related to the perimenopause, menopause, and there's genetic factors as well that can add to weight gain. So there's so many things that people are having to deal with. So it's really important to kind of recognize that those are issues and then try and help manage those the best we can. So when we think about, what is it that we should be doing? Just for some extra advice, I think, Rupa, the webinars are really helpful to listen to. And I know you do those with Ruth, who's a nutritionist, who can give some really valuable advice. So we can hopefully share some of the links of when the next webinars are available. There's also a weight loss podcast that actually was only launched yesterday, and which was an interesting experience to be part of. So we've done a little section on the menopause specifically, but actually it's a relevant podcast overall to somebody who's going through the menopause, who potentially is thinking that weight gain is an issue for them. And then the things that we, probably the worst time coming up to Christmas, but the good things to cut out of your lifestyle if you can, moderate in moderation, would be
Yeah.
alcohol and sugar. So
Yeah. Yep. Absolutely. Should we
right.
move to sleep? This is really interesting, and I'm sure Zara's going to explain it really well. The importance of sleep, and I didn't actually understand it myself until I started researching and doing these webinars. To be honest with you, and the impact that poor sleep has.
Yeah, well, I think we all know that if you've had a bad night's sleep, certainly it makes me very grumpy the next
Yeah.
day. And it can really affect your overall well-being, can't it? I think, when you don't get a good night's sleep, and for whatever reason, it has again impacts on so many parts of what food choices you make, like how your mood is in terms of exercise, wanting to exercise and go out. And so it really does have a huge role on how we are in our day-to-day lives. Um, from the information that we have, around 12% of women experience sleep complaints overall. But actually, when it comes to the perimenopause or menopause, that goes up to 40%. So that's a huge number of people that are struggling because of their sleep. And again, there could be lots of different reasons for this. So let's think through some of the things that we've already spoken about: night sweats, insomnia, sleep apnea, and snoring. So sleep apnea is obviously a medical term that we kind of throw about, but it's sometimes where people have little pauses in their breathing, and this can be for a number of reasons. But actually, what we have seen is that hormones, good old hormones, do also play a part in this. And so, where there is a drop in hormone, which we haven't actually mentioned so far, progesterone, that can affect the kind of way that our body responds to sleep and breathing. Estrogen, which we have mentioned a lot, is also has an impact because it affects the what we call the sleep-wake cycle, and because it can affect levels of certain hormones within the brain. So something called serotonin, which we referred to earlier, which is important in regulation of mood. There are consequences to having poor sleep. So I know it's very easy to say, well, you shouldn't have poor sleep because obviously talked about all the reasons why we do get poor sleep, but why it's important to try and help this is because lack of sleep can lead to other health consequences. So a rise in your blood pressure, raised cortisol, which is like a stress hormone levels, weight gain, and those factors can potentially put somebody at an increased risk of conditions such as type 2 diabetes.
Oh, bear with me. My slides are doing something a bit funny here. There you go. There we are.
So I think one of the things that we've got on the slide there is about management. So management seems fairly easy to kind of throw about as a terminology. I think sleep is a really complex issue, and I think it's very difficult to try and get that back on track for some people. Obviously, where possible, and to manage symptoms of night sweats to try and reduce those effects. Potentially, if sleep apnea, so the pausing, the breathing issue, is a real like concern for you or for your partner even, who may actually be more aware that it's something that's going on with you, then there may be scope for seeing a specialist about that. And then there are the things that actually we need to do just from a, like what we would call sleep hygiene perspective. So actually, these are the good things to do for everybody who has issues with sleep, whether or not you're menopausal or not. So making sure that the room is dark. So obviously light naturally stimulates us to be more awake. So potentially if you're struggling, or I know we're coming into the kind of darker, deep dark days of winter, but if summer months are maybe using blackout blinds, if that's appropriate for you, just to try and regulate your natural sleep rhythm, making sure that you turn off the TV at least an hour before going to bed. We know that that blue light from the screen or from your phone actually just stimulates us to be a bit awake a bit more. And then temperature within the room. So we know that like night sweats, actually, let's try and make all the things that we can do better to try and reduce the night sweats. So try and keep the room maybe slightly cooler to be more comfortable, and adjust your bedding as well. So if make sure that you've got the bed the way that you like it, maybe more so than a partner, because actually at this point you're the one struggling more. And then Rupa mentioned about triggers for hot flushes, which are similar to night sweats. So avoiding the things like spicy foods, caffeine, hot drinks, smoking, alcohol. Typically I think people sometimes think alcohol can be relaxing and potentially could help you go to sleep better, but actually it's kind of drives in more of an artificial sleep than like kind of natural sleep. So it's better to avoid it.
I think as well, yeah, more people are working from home now as well, and a lot of people have their desks set up in their bedroom. And if it is possible not to have a separate area, if it's possible to do so, because that environment isn't necessarily healthy for when you're encourage better sleep. So something to think about.
I know we've got some questions, so hopefully we will be able to get back to them. I think some of them are around HRT, so we will go into that in a little bit more detail. And we've got a specific section where we're going to talk about vitamins and supplements, because I know we've got a question about that. But we do actually, just coming back to one of the questions before we move on, is about joint pain. So someone's written, can this sort of, I think any sort of joint pain be quite severe in a short period of time, making it hard to walk? Potentially, some people really do struggle with joint pain around the menopause. Again, we would always kind of say it, looking at a wider picture. So if joint pain was maybe your only symptom and you had some other symptoms that suggested a different cause, we would need to kind of look at that more broadly. But if you had typical symptoms around the menopause, and you were experiencing joint pain, it could well be that it is a symptom of the menopause and that you would benefit from some potential treatment. Okay. And then we've got a question about when you should start getting help, but we'll definitely come back to that one later. Okay. Right, Rupa.
Skin is another important one where we're losing about, I think, 30% of collagen, aren't we, when we hit the menopause?
That's absolutely right. And so just as a reminder, Rupa, you are hosting a webinar with two of our skin experts from Boots Online Doctor in 2 weeks' time. So that'll be exactly 2 weeks from today for anyone that wants to get a little bit of more in-depth understanding of what's going on. And you mentioned collagen. Again, it's something that you see kind of bandied about quite a lot. Collagen is really important in terms of wound healing and muscle repair. And so, as you've mentioned, the levels drop down, and that can mean that people experience dry skin, increasing kind of signs of aging because of wrinkles and things are appearing more, and sagging of the skin. We also see that it makes women more easily bleed or bruise because they've not got such a protective layer around the skin as much as maybe did before. It also, unfortunately, the menopause can actually worsen some pre-existing skin conditions. So if somebody already has a history, for example, of eczema or psoriasis or rosacea, you may see that worsen. We also see changes that come up. So, typically, I think people think of acne as like a teenager's condition, but we see this kind of second peak around the menopause with people experiencing acne symptoms. And also another kind of common issue that people report related to the skin is increased hair growth. So it's worth just thinking about some of those symptoms can be relatively easily managed with topical treatments and creams, and there's lots of products available.
I think also I just wanted to link that when you have poor sleep, most people find that their skin is pretty bad as well. I know if I don't sleep well, you can tell that the skin is a bit more dry and flat, and it just feels horrible. So again, the importance of sleep with all these symptoms that we're talking about.
So I think what we're going to do is just ask people a little bit about treatment. I know we've got some questions around treatment, so I'm just going to start by doing our final poll of the webinar, just to get a bit of an understanding of what kind of treatment expectations people have. So this would just be an understanding if anyone is on HRT, for example, or using supplements. We may not be on anything at the moment at all. Give it a few more seconds, and then I'll share the results with everybody. Okay. So So really interesting, actually. We've got a fair chunk of people that are not taking anything at all. And then a fair number who are on HRT with or without supplements, and then some people who are on just supplements alone. So that's really helpful. I'm just going to go back to some of the questions before we move forward, just to share them with you, and then hopefully we will cover those in our next few slides. So we've got a question about why might someone not be able to be prescribed HRT? I will actually answer that one just before we start. There could be a number of reasons. I know that sounds very generic, but so for example, you may have certain medical conditions that may mean that you're not suitable. Examples of which, well, there are complexities to around it. So say, for example, you've had a gynecological cancer, it'd be something that would need to be discussed with a specialist before starting HRT. So for example, breast cancer or ovarian cancer doesn't always mean you can't have it, but it's just sometimes that it needs just more specialist involvement. Or for example, you've had a previous blood clot, a pulmonary embolism, a blood clot in the lungs or in your legs, we just need specialist input before making sure about weighing up the risks and benefits of HRT. We've had a question, are there any specific vitamins and supplements that we can take to help? So that is something that we will be coming on to. So that's definitely going to cover that. Can we get testosterone to supplement HRT? One can. We don't currently prescribe it through Boots Online Doctor. It's something that we are hoping to do. We do feel that it's a very good addition for some people, depending on what symptoms they've got. If you are, and normally for people who want to get testosterone, as you mentioned, it would be to supplement the kind of traditional types of HRT. And that's something that some people's GPs may feel comfortable with. Some GPs are not very familiar with prescribing testosterone and may refer you to your local menopause clinic if that's appropriate for you. We've got, at what point can you decide to go on HRT and what are the pros and cons? So we will talk a little bit about the pros and cons of HRT. At what point can you decide to go on it is very much, I suppose, a discussion largely in what you want and what your symptoms are, and obviously having that discussion with your healthcare professional. If somebody is experiencing symptoms related to the menopause and clinically it's safe for them to have HRT, there isn't a defined time frame of when someone can or cannot start HRT. What can help with brain fog and memory problems? So again, we will come on to treatment options, so hopefully that will help with that question. And then we've got a question about collagen supplements, so I think we will also cover that later on.
Yeah, that will be quite a lot in our skin and menopause webinar in 2 weeks.
Point. Yeah, so for the person that asked that question, hopefully you'll be able to join. We are recording these webinars, so if you aren't able to join in 2 weeks' time, it should still be available for you to see on our YouTube channel if that's easier for you. We've got question about someone who's on the coil, which is due to be removed next month, and they're asking about patches. So we will go into that a little bit. We can't necessarily talk about each kind of individual HRT regime, but for somebody who is on a coil, for example, a hormonal coil, and is using estrogen patches, it's really, really important that you have that progesterone cover for your HRT. So if you were to have your coil removed, you just need to discuss what you supplement that with instead of the coil. Doesn't mean you have to stop HRT. There's a question about if you think you're perimenopausal, when should you start thinking about doing something or seeking support from the GP? There is no black and white answer to that. That is very much on how much it's affecting you. Some people may be perimenopausal, go through the menopause and not want to do anything about it because actually they're not too bothered by it. They're not really getting any symptoms. They don't wish to kind of engage with it. Someone else may be very symptomatic. And so actually if that is you and you are bothered by your symptoms, then the sooner you go and get some advice and support, the better. So you shouldn't have to be suffering if you are symptomatic from it. Is evening primrose oil supplement helpful? I'm not sure, do we cover that one later, Rupa? Evening primrose oil.
Primrose, no. But I would actually consult a pharmacist in store about these kind of supplements. Got information around all of this in quite a lot of detail. Yeah. they'll be able to, and there's different manufacturing companies that give specific details on all of this. So it depends on which evening primrose oil you're going to go for. But Boots in store have loads and loads of choices, but definitely consult the pharmacy team.
Yeah, and they'll be able to tell you also, the pharmacy team should be able to tell you about any interactions that you have. If you're on medication already, obviously it's really important to be thinking about interactions, and we will touch on that. But the pharmacy team do have the ability to just check those interactions for you. So do mention it to them when you're buying something. We've got a question about what kind of changes indicate menopausal symptoms. I think we'll come back to that one at the end, because that's maybe one we can go back to one of our previous slides to talk about a bit more. Okay.
Actually got 10 minutes and there's quite a lot of
That's
we could be here for another hour actually, but
So I think what we're going to do now is just to talk about HRT. So as we mentioned, it's something that we do a lot. We're very involved with it. It's not for everybody, and it's obviously not suitable for everyone. I think, if we look back maybe 10, 15 years, there was lots of kind of uncertainty around HRT, and I think people have a lot more confidence in it now. HRT has been around for a long time, hormone replacement therapy. I think we use HRT very commonly, but for anyone that's not sure, hormone replacement therapy. And it first became available in the UK in 1965. So we're primarily looking to replace two hormones when we think about HRT. The estrogen that I've talked about probably for the last hour as being responsible for all the symptoms. So that's the one that we need to try and look to replace. But we also, and we mentioned this in the question about the coil, there is a second hormone that's really important for some women, not for everyone. There'll be different circumstances for some people, but for a woman who typically has not got a coil and hasn't got who hasn't got a womb because they've had a hysterectomy, then you need to have progesterone, and progesterone may help with some of the symptoms, but its primary job is to protect the womb from the estrogen. Because if you leave just having the estrogen without the progesterone, what that can do is cause the womb lining to thicken, and that potentially could be unsafe for somebody. So it's really important that if you are prescribed both hormones, that you do take both hormones.
and as you said, the HRTs comes such a long way from the many years that it first came out from. It used to be made from horse's urine, didn't it? The tablets, which is kind of disgusting to think about, but it is true because it's rich in estrogen. But now we've got different types of HRT that exist. So you can have estrogen through a patch, a gel, or a spray, and there's very safe progesterones to go along with it. And the kind of HRT that suits you when you have a discussion with your clinician is based on a lot of things like your age, your weight, your medical history, and even family history of certain cancers and health problems like heart disease, stroke, and things like that. But they will be able to give you options for safe use of HRT, which is really, really important. And like we've mentioned already, there's vaginal estrogen for the vaginal dryness, which can be either used alone or with your HRT.
Yeah, I think it's also important to just recognise that it doesn't generally work immediately. So although people can sometimes see benefits quite quickly, typically most symptoms can take 3 to 6 months to see improvement, and people will respond differently. So people absorb estrogen differently. For some people, they absorb estrogen very well through a tablet, and some people absorb better through a patch or a gel. And so it's not a one size fits all approach. We can often recommend the kind of safest option and potentially what will be the best option, but that may need tweaking. The doses may need adjusting. For some people, certain regimes just don't work and don't suit them. And so it does take a little bit of time to sometimes just find the sweet spot in terms of managing your symptom, and also then thinking forward. So you might find that when you start HRT, you're on a certain regime that works really well for you, and you're on it for a few years, then maybe actually you don't need as much estrogen. So typically women who are younger need more estrogen, and as you get older, the estrogen requirements should settle down as your body kind of readjusts to its new normal.
Perfect. Supplements and natural remedies, which I know that women are interested in. And the concept behind this normally is that it's probably the thinking around it is that it's quite safe to use. I'll use supplements and natural herbal remedies for my symptoms. But the problem with this is that there's not enough evidence to say that this works. So what happens is that women find the supplements, They start taking it. They do find some relief of menopausal symptoms, but we don't know how much to take and how long to take it for. And unfortunately, like I said, there's no evidence to suggest anything else. So what happens is that you end up taking these supplements unnecessarily and have side effects unnecessarily as well, on top of your menopausal symptoms that tend to return after a while. And the other important point to note is that a lot of supplements and natural remedies do actually interact with medication and certain medical conditions like diabetes, epilepsy, heart disease, blood pressure. So like I've mentioned before, it's really important that you ask. A pharmacist is an ideal person who can help you with those interactions and checking that you're safe to take. Now, I'm going to mention a few ingredients that people have probably heard of before. Black cohosh, and sage. Now, these are really good ingredients that help with hot flushes and night sweats, but they can interfere with blood pressure medication, for example. So make sure you have that checked. Ginkgo biloba is one that's really good for your cognitive health, so your memory and your concentration, but it does interact with certain medication that thins your blood. There's something called Agnus castus, which is used for PMS, so premenstrual cycle syndromes. That is helps with the mood when you're coming on in your period. But what happens is that interacts with the contraceptive pill. So a lot of women are on the contraceptive pill and just need to make sure that there isn't a significant interaction there. And lastly, there's something called red clover and soy, which are powerful phytoestrogens. So these are chemicals that are found in plant foods that mimic the action of estrogen. And they bind to the estrogen receptors and help with certain symptoms like the classic ones that we've mentioned already. But these can also interact with, for example, thyroid medication and blood thinners as well. But certain foods do have these phytoestrogens as well. There's things like flax seeds, sesame oil, sesame seeds, sunflower seeds, and pulses and beans, and some vegetables like tomatoes, red onions, celery. So again, if you are looking at supplements, there's a specific logo that you can look out for. It's called THR, which stands for Traditional Herbal Registration. You'll see those 3 letters on the packaging, and that normally means that it's been approved and regulated by a body to say that it's safe to take. So look out for THR. Now, a common question that we got asked here is, can I take supplements along with HRT as well? There is no studies to say that it's safe to take. There isn't enough information to provide, a realistic goal or aim with this. So the British Menopause Society say it's best to avoid taking supplements with HRT and just stick to the HRT if that's working for you.
Great, thanks, Rupa. I think hopefully that answers some of the questions from earlier. I know we had a question, and it's in the chat as well, about brain fog and memory. Obviously, it's very difficult for us to give individual advice, but if you are someone who maybe is interested in HRT and perhaps you're not on it already, and you think that it's something you'd like to discuss, and it's worth having that discussion with your GP, because it potentially would help those symptoms. Okay. I'm conscious of time, Rupa. I know we're due to finish at 1. We do have a couple more bits to talk about, so we'd like to kind of carry on with that. Obviously, hopefully that you can stay on and join us. So we are going to talk about movement. So in terms of exercise and physical activity, we talked a little bit about why sometimes particularly things like joint pain may affect people doing exercise, and it's estimated that generally around 40% of women don't get enough exercise. So that's kind of normal, non-menopausal women. But actually, when we get to the menopause, it's even higher. And there are multiple reasons for that: a potential lack of motivation, lack of energy, changes in mood. And so by not exercising, that again can put someone at increased risk of more chronic conditions, so weight gain, heart disease, and diabetes. Rupa, I think you were just going to talk about the benefits of
Yeah, the benefits of exercise. It's pretty obvious what the benefits are. I mean, besides helping your weight management, but it also improves your heart health, it improves your sleep. which we've talked about. That's really important. Your mood, it really helps elevate your mood and reduce those stress levels and of anxiety as well. It supports your bone health and it supports your muscle mass, which tends to drop, like Zahra said, as you age. There's different types of exercises, and it can be really difficult sometimes to see which one is the best one to do. I would always say that do what you enjoy first, because some people aren't motivated to exercise like me. I have zero motivation for exercising, but I like to find something that I'm going to enjoy. So there's things like strength and resistant exercises that uses your own body weight, or you can use weights as well to get your muscles to work a bit better. Examples of this include squats or bicep curls and ankle taps. There's also cardio and aerobic exercise, something that gets your heart pumping. And you can do things like walking, dancing, swimming, cycling if you enjoy those. And it's also quite good to get a buddy involved. Maybe you've got a neighbor, a friend, or family, or a work colleague. So use your lunch break. That's quite a good time to go out for walks. Don't work during your lunch break. You should be out and using that time to do something a bit different. And I suggest always to go out for walks while you have your lunch. And once you start making these small steps, you're going to find it easier to make it a habit, because exercise is something as you age that has to be part of your lifestyle. It's for your general well-being. You're going to have to continue with it. For me, unfortunately, that is the case.
And hopefully we haven't stopped too many of you having your lunch breaks today and been able to do this on the side. We're going to just finish off today by talking about nutrition. So there's lots of aspects to nutrition, as we mentioned. It's something that we talk about a little bit more in our weight loss webinars and also in the recent weight loss podcast that we've done, which was for the menopause episode specifically. One of the things I spoke about was nutrition, but we'll try and cover a little bit of that today as well. So typically when we think about diet, we're thinking about a Mediterranean diet. There's a good option for someone who's going through the menopause. And what do we mean by that? We're diet that's kind of got a high content of fruit and vegetables, as well as legumes. So we mean like beans, pulses, lentils, nuts and whole grains. And overall, this can help reduce the inflammation in the body, improve the immune system, and reduce the overall risk of heart disease. We also look to a diet that's rich in olive oil and nuts, because they contain the healthy fats, which are omega-3 rich, and a diet that's got less red meat, less saturated fat, more fish, keeping your heart in good shape, reducing cholesterol, reducing inflammation. And so they can also have a positive impact on your brain and your overall lifespan. There are also some kind of key supplements that are important to think about. And I mentioned them briefly when we were talking about bone health and joint problems. So one of them is vitamin D, and that's particularly relevant in this country. You know, we mentioned that we're going into the winter, it's getting darker earlier, and vitamin D typically comes from the sunlight. And so actually the majority of people in this country probably do need some form of vitamin D supplementation. It's important to supplement to strengthen your bones and can help the absorption of calcium, another key vitamin, which then keeps your teeth and your muscles healthy. When people have low vitamin D, they can be at risk of falls and fractures. So I mentioned that sunlight is obviously one of the ways that we get vitamin D. There are a couple of other ones as well, and it's sometimes through fortified foods. But generally, sunlight is the best option for it. Calcium is the other thing to think about. So again, with bone health, rich calcium foods include milk, yogurt, kefir, cheese, dark green leafy vegetables like broccoli, kale, nuts such as almonds, dried fruit, pulses, tofu, lots of things that are calcium rich that are important to incorporate in your diet where you can. And then the other thing that we kind of think that's important from a dietary perspective is to be avoiding foods that are have a high glycemic index, or or high GI carbs. You may have also heard them referred to. And what that is, it's a rating system for foods containing high carbohydrates. So although we do need and we recognise that there is a real importance to have carbohydrate in the diet, there are some simple switches that people can make that would mean that they have a low GI carb, so one that releases energy slowly. And these tend to be things like brown rice, brown pasta, brown bread. Rupa, there's a couple of other things that are really important as well, just from a general health perspective, for women going through the menopause. Stopping smoking, reducing caffeine and alcohol. And we mentioned caffeine and alcohol specifically. They obviously have other health benefits of stopping, but one of the things that we've kind of repeatedly talked about is hot flushes and night sweats. So that can also be helpful there. We've come to the end of our presentation. We do have a couple of questions, so I'm just going to go through those. So one of the questions was about how long can you be on HRT for? So typically we suggest a review after being on HRT for 5 years, but obviously that can be very dependent on when you've actually started it, and a review at the age of 60, because there is an increased risk from the age of 60. So without trying to be too vague, it does depend a little bit on kind of when you started and where you are in your journey. But say on average, at least a review at 5 years as to whether it's the right thing for you to be carrying on. And in terms of, so there's a question about, from a dietary perspective, about if you can't do dairy, what's the best milk substitute for calcium? So we mentioned that almonds are rich in calcium, so it's worth just having a look at the alternatives and checking the calcium content on those on the alternatives, depending also on what you like and what you tolerate, because obviously it's really important that it's something that you're going to want to have in your diet to look at. If somebody is potentially really struggling to get calcium in their diet, obviously there can be a role for vitamin supplementation with calcium vitamins, but that again is very much an individual kind of assessment to be made. And then I just want to go back to that question about what kind of changes indicate menopausal symptoms. Rupa, I wondered if you could go back to the slide that we have about all the different symptoms. So where we talked earlier about the 40 different symptoms that we have.
Yep.
Probably quite early on in our presentation. I can't remember exactly where it is.
There we go.
Yeah, so this is obviously quite a kind of slide with lots of information on. There can, in response to your question, there can be lots and lots of different symptoms. And that's the kind of key here, is that, try making sure that you're heard. If you think that this is something that you may be experiencing, it may be that the first symptom you go and present with may not be kind of classic of the menopause, and it may be that this builds up over a picture of time alongside other things that are going on. It isn't black and white. So somebody may be experiencing anxiety and depression, and they happen to be 50. That doesn't necessarily mean it is related to the menopause. There could be other things going on. So I think the most important thing is to be kind of going through and talking through with your GP, your doctor, whoever you are seeing, about your symptoms and how to manage them. And if things aren't getting better, to consider the menopause if it's something that hasn't been considered before. And also just kind of looking at the picture. So are there multiple symptoms from this list that maybe are affecting you, that potentially you would then benefit from some treatment from?
We've also posted the link to a questionnaire that can be used, that we've mentioned a few times in this webinar now as well. So like I said, a powerful tool for you to use. And if you do go on treatment, it's quite a good questionnaire and a tool to use to monitor your symptoms and what's improving. So Janie's kindly shared that link in the chat box.
And I think she's also shared the link, so somebody asked for that about the skin webinar. So thanks, Janie, for sharing that. And as I mentioned, it will be recorded. So if you aren't able to join us, we recognise that this doesn't work. This time doesn't work for everyone. Obviously, people are working, but hopefully the recordings will just mean that they're more accessible for you in the future. I just want to thank everyone for their time today. We've really enjoyed all your questions, and the interaction has been really great for us to be part of this. We're really proud to be discussing the menopause. It's something that we're both very passionate about, really enjoyed talking about, and we hope that you found it valuable.
Excellent. Thank you, everybody. We look forward to having you on the skin one. Don't forget, that's in 2 weeks' time. And Janie as well, thank you for doing everything behind the scenes, looking after us and our audience as well. Thank you.
I apologise for my cold. It's that time of year as well. All right. Enjoy the rest of your day, everyone. Thanks very much. Bye for now.